Good evening and welcome to First Say Chats by Dr. G. I'm Dr. Adana Grandison, a physician in Barbados and your hostess for this evening. First Say Chats by Dr. G is a live podcast that provides listeners with a unique opportunity to not only hear complicated medical conditions explained, but also clarify any misunderstandings you may have about that condition. After all, a medically aware and educated patient is an empowered patient. And this evening, our episode is entitled The Golden Years Managing Dementia. And our guest this evening, is Dr. Ambrose Ramsey. Dr. Ramsey is a fully registered medical practitioner in Barbados, and he specializes in internal medicine and geriatric medicine. He is a medical graduate of the University of the West Indies Cave Hill campus, a fellow of the American College of Physicians, and a member of the American Geriatrics Society. Dr. Ramsey is a consultant geriatrician and is based at the Geriatric Hospital on Beccles Road in St. Michael, and he also has a private practice here on the island in Wildy, St. Michael. His affiliations are as an associate lecturer in the geriatric medicine specialty with the Faculty of Medical Sciences at Cave Hill campus, and also serves as a consultant to the Barbados Alzheimer's Association. Good evening and welcome, Dr. Ramsey.
Good evening, Dr. G. Good evening, listeners.
Hi, Dr. Ramsey. So this evening, we're talking about the golden years, and our focus is going to be on dementia. But this evening, before we started talking about dementia, I think we need to take a step back and really differentiate and lend some clarity between delirium and dementia. Can you first do that by just giving us a bit of clarity about the two terms and how sometimes we can interchangeably and mistakenly use those terms?
Yeah, sure, Dr. G. Right. Now, dementia and delirium are both described as confusional states. It's a situation where, since we're talking about older persons, and the individual acts strange and they will behave confident, so they become confused. Now, delirium is a reversible type of confusion. It's normally caused by an underlying illness, let's say something as simple as a urinary tract infection, um, something like pneumonia. And if the person is diabetic and the blood sugar is way out of control, there are many underlying conditions that can cause someone to be confused and become delirious. Now, dementia, on the other hand, is a type of confusion that doesn't go away, it doesn't get better, it gets worse as time goes on. So the person becomes confused, they may be mildly confused, um, they may become disoriented from time to time, and then later on, it progresses to a point where they become very forgetful and on and on.
Great. I like the fact that you made that very clear distinction, and I think it is now quite important that we continue to go on about dementia. You said it is essentially a deterioration in memory and other cognitive ability, and this deterioration can essentially affect activities of daily living, and it's not reversible. Can you tell me approximately when should we start to expect to see a person developing signs and symptoms associated with dementia?
I would say the biggest risk factor is age. So
Right.
most commonly in persons who are over age 60, some literature would report 60, Most common, however, over age 65, even though
Right.
it can occur earlier. So, usually, once you get above the age of 65, then you will start to look. And, I'm not saying that you look at everyone who's over 65 and think they're demented. Quite the contrary. That's far from the truth. The majority of persons who suffer from dementia tend to be more in the advanced age group, over 80 into the 90s, etc. The risk um, becomes greater as you become older. So age is, I would say, the biggest risk factor. Now, you would become suspicious if the individual starts to show some of the what are described as warning signs of dementia. So age plus certain signs will help to trigger the suspicion.
Okay. And can you tell us what are some of those signs or symptoms that we should be looking for, or that
Right.
caretakers
So,
or other family members really should be looking for?
yeah, sure. Again, okay, the 10 warning signs as listed by the Alzheimer's Association would include memory loss. So the individual becomes forgetful, and because of the forgetfulness, the individual may repeat themselves. So they may ask the same question over and over, or they may make a statement, numerous times in a day, or maybe it could be a bit more subtle in that they may repeat the same statement over a period of, let's say, weeks. Within the same week, they may make the same statement. Now, the average person would remember that they would have discussed a particular, um, event or activity, but because of the lack of memory, the person will repeat the reporting on the event or repeat the question. Now, another, yes, you wanted to
No, no,
come in
no. Go
here?
ahead. I was saying no,
Right.
no, no.
So there's also difficulty performing familiar tasks. So simple things like, let's say, making a cup of tea or chocolate or coffee may become difficult. The person may, let's say, go into the kitchen and all of a sudden they're not sure. They may take the cup and then they may not be sure what to do with it. They may lose the you know the they forget the steps involved in preparing that cup of coffee. Um, Problems with language. So the individual may start using inappropriate words within a sentence, or um, they may start to use words that they're not accustomed to using. There are many cases where people who would have never, used a curse word in Bayesian terms or foul language or an expletive in their life, and then they may start using them more often. Another sign: disorientation, getting lost. Okay, disorientation to time and place. Losing track of the time of day. They may think that 6 a.m. in the morning is 6 p.m. or it may be a more stark contrast where in the middle of the day they may think that it's nighttime. And disorientation to place. The person may be, in a place that would normally be familiar to them, and all of a sudden not know where they are. Not all of a sudden, and that's another thing. But they may be in a location where um, they're accustomed going, etc., and now they cannot find their way around that location. Judgment, poor or impaired judgment. Um, Risk, which would then involve maybe risky behavior. For example, the person may decide to go for a walk at 2 a.m. and in their night clothes. Okay.
Right.
Then you can have, or they may decide to cross the road without regard for the traffic. Okay, another example that you can have includes problems with abstract thinking, which would involve planning, let's say, balancing the checkbook, and maybe preparing a list of grocery list to go shopping, etc. Then, as a direct, again, effect of the memory loss, the individual misplaces things. So they will quite often, a common one is they would hide their money in some place where they wouldn't normally keep the money, and then accuse other persons of stealing it. Okay. You can
Right.
have changes in mood or behavior, uh, and you can have changes in personality. So you can have somebody who was quite friendly and jovial becoming withdrawn and not interacting anymore. You can have the opposite as well occurring. And then of course you can also have loss of initiative. So that is the ability to initiate, to start, to get things done. So the individual may
Right.
sit, as if they're lost all day. So those are 10 warning signs as described by the promoted by the Alzheimer's Association to help the public out there to be able to identify or raise the red flags to try so that we can try to um, diagnose this illness earlier.
Right. Now, you actually highlighted one of the signs or red flags that you should look out for as losing or misplacing things. Now, even myself, from time to time, you may what we say in Bajan vernacular, you may put it up so good you can't even find it. Is there a difference between normal aging and dementia?
Oh yeah, right. Normally, what you would have
Because I,
described, right?
because I
What you
think
would have
everybody now
described,
might be saying everybody might be thinking now, oh dear, I may have dementia. So
Dr.
give
G's
some
on the way.
clarification. Let's give some clarification on difference between normal aging and dementia.
Right. So when the normal age, and as you get older, it's quite natural to find it more difficult to learn new things. It doesn't mean you can't learn. It just takes a little bit longer to learn new things. The You may find it forget you become well you forget. Okay, it's difficult to learn new things and you become more forgetful. And that you may common one is putting the key misplacing the keys, and that quite happens when you may walk into the house and you drop the keys someplace where you wouldn't normally put them. You may come into the house with something on your mind and you just leave the keys and you go straight to it, and then you realize, hey, what did I do with my keys? They're not where I normally put them. Now someone with dementia will, well, they may not even realize that the keys are missing, or not seeing the keys where they normally should be, will immediately assume that somebody took them. Okay, and they may go about uh, calling the locksmith to change all the locks and get a whole new set of keys because they have no, as far as they're concerned, the keys were taken. Now, the person who in a situation where it's just simple memory loss, the like Dr. G, you would think, now what did I do? I came into the, I had to use those keys to get in the door. When I came in, I went this place, and you start backtracking, and eventually you'll find them.
Right.
Okay, so I would say that's the major difference there.
Okay.
The ability
Excellent.
to plan, to think, solve the problem. The keys are missing, you think, you can, you remember what you would have done when you last had the keys. And in your mind, you think, well, you know what? They have to be somewhere where I would have, where I would have, where I would have traveled. And those
Right.
are the places you start looking.
Okay, we have a caller here. I am just going to put them on to live now. Good evening, caller. You're live.
Good evening, doctor.
Good evening, sir.
Yes, I want to raise a question
Caller,
along
can
the
you please
similar.
turn down? Can you please turn down your background because we're not hearing you very clearly?
Yeah, sorry about that. My question is along the same line. What about circumstances where you leave your bedroom on your way to your kitchen for something, and you get to the kitchen and you forget what that thing is? How should that be viewed?
Yeah, I mean that is very common, and it happens to young people too. It happens to me sometimes, and I don't think I'm on the way as yet. But quite often, and with busy lifestyles, things like that happen. Um, if most persons who, if you leave the bedroom and you say to yourself, "I'm going to the kitchen to get a cup of tea or coffee or whatever," and that's the only thing on your mind, chances are you're gonna get your cup of coffee or tea and come back. Gosh, I had a terrible day at work today. I hate my boss. Um, I didn't get to do the things that I wanted to do today. I'm here. Um, I came home and the dinner isn't ready. If you have other things on your mind, it will tend to distract you and break your train of thought. But you know, what happens is quite often when you stay and you think, when you stand up and you think, no, why did I come here? And as I described earlier, most people will go back to the point where they were in the bedroom, okay, was in the bedroom doing this, and they decided to come and get, oh, yes, I was going to get a cup of coffee. Maybe not a very good example, because if you're going to get a cup of coffee or tea, there are going to be some other, um, signals coming from the body. You might be hungry. You may have the taste, have that, developing that taste for the coffee, and chances are you're not going to forget it. So I hope I've answered your question.
I think you did. Um, I have another question here from one of our members who are actually messaging in. And Zilly asks, can it be hereditary?
Can dementia be hereditary?
Absolutely.
There are, well, as it relates to, well, if I come back to dementia a little bit about, there are different types, okay?
Great.
Dementia um, is like an umbrella term describing a number of different illnesses that also cause dementia. So it's a syndrome, a constellation of symptoms and signs which I would have described earlier, but there are different diseases that can cause it. And Alzheimer's
Mm-hmm.
is, yes, hello, you're still with me? Okay, good. Now, there are certain types of Alzheimer's dementia that are hereditary. Even within Alzheimer's, there are different subsets, and there's a lot of research going on now. And there are certain types that have been identified that are early onset that are hereditary. So the early onset type Alzheimer's.
Hello, Dr. Ramsey, are you hearing us? Hello.
Yes, hello.
Hi, Dr.
Oh,
Ramsey. I think
yes,
we
I'm
lost.
still here. You
I
lost
think
me.
I think we lost you a bit. You were talking
Okay.
about the different types of dementia, and then you went on to speak about the that some of the types of Alzheimer's type dementia can be hereditary.
Yes, that's all you heard. Okay,
Yes, please.
so I'm sorry about that. I don't know what
It's okay.
happened. Yes, but right, there are some types of Alzheimer's that are early onset, which means they started off like on the age 60, and there's certain types where you will have all the siblings, developing the illness, and it would have also been present in maybe one or both of the parents. And so these are the types that hereditary, which means they're passed on. But the majority of types of Alzheimer's occur in the over age 65 group, and they're not, let's say, they don't have that strong heredity.
Right,
Um, However, people who have Alzheimer's in their family are at a greater risk of developing Alzheimer's. And this is where the lifestyle risk factors play an important part. So the persons who let's say if you have, and there are some twin studies that have been done, and what has come out was that the twin the twin the part of the twin that, for want of the better word, the part of the twin that lived the healthy lifestyle was, even though they still had let's say Alzheimer's onset, they were able to delay that onset by a significant amount of in some cases years. Okay,
right,
so one twin would have developed the illness, and the other one who lived a healthier lifestyle would have developed the illness later on.
right.
So lifestyle interventions can delay the onset, and in some cases actually stop the onset altogether.
Okay, great. Now, for those of us who actually didn't hear about the different types of dementia, I know Alzheimer's disease is actually probably the most common type of dementia out there. But can you just quickly go through some of the other types?
Yes, sure. Right. So there are a number of other types, and I would say the most common would be Alzheimer's.
Right,
Okay. The next most common cause, I mean, this is, and in the literature, they will tell you that the next most common cause will be the Lewy body type dementia. It's just a type of dementia that where the person develops the symptoms, signs of dementia at about the same time as which they develop signs of Parkinson's disease. Okay, Parkinson's disease is an illness that causes difficulty walking, it causes a tremor, the hands to shake, the head to shake,
right,
etc. And so that's another
right,
type, Lewy body dementia. Vascular dementia, right, is very common. Vascular dementia is the type of dementia that occurs because of many strokes, tiny little strokes, um, which occur in the brain. By a stroke, I mean, most people who are familiar with stroke will think of someone with weakness on one side of the body or inability to move one side of the body, and they may or may not have difficulty speaking. They may have slurred speech.
right,
Now you can, right? So you can have um, what has been described as mini strokes, where the damage to the brain is at a level which it doesn't cause you to be able to see that the person has damage. In other words, they look perfectly normal, they walk, they talk perfectly normal, but the only problem that they're having is they're starting to develop difficulty with their memory and all the other signs that I would have described earlier. Now, um, right. So, and another type of so those are the I would say the most common types, right? The Alzheimer's, the vascular type, the Lewy body type. Okay, but there are also other um, causes of dementia. There's one called frontotemporal dementia or PIC. It was called PIC's disease. And this affects mostly the frontal parts of the brain and tends to affect that have fairly good memory and they may be able to perform, you know, at a relatively high level of function. They can take care of themselves fairly well, but just that they do really odd, impulsive things. All right. And it's a really, difficult type of dementia to deal with. And that one tends to affect, I would say, a younger age category. So
Is
usually young people with dementia, right, right. Frontotemporal
tend to
is one of the ones that we think of.
right.
Yes, Dr.
Um,
Grandison.
can can chronic alcoholism lead to dementia?
Yes, certainly. Yes, certainly. Chronic alcohol, there are so
Okay.
many causes, huh? Um,
Right.
Chronic alcohol use and repetitive head injury, but you hear of the punch drunk boxer. You talk about
Yeah.
alcohol, which causes, people to get drunk. You can also hear about the punch drunk boxer. During the fight, the person starts to, stagger and, because the brain has been damaged, concussion, the brain isn't working properly and the body can't function properly. Now, over years, repetitive trauma to the brain like that can eventually cause dementia. And there's been a
Right.
lot of media attention in recent years to football players. I think mainly football players in the
Absolutely. For
US,
not
many of
for not
whom,
having
a significant
headgear.
amount of whom um, develop dementia type symptoms later on. So,
Right.
right, so there are a lot of other things that can actually cause dementia, but the ones that I mentioned earlier are the chief causes.
Okay, great. We have another question
Now,
here from Tonia. She says, I was just wondering about menopausal stage. Can ladies become a bit forgetful and confused, or is menopause really related to the dementia, or there's no distinction between the two?
um, menopause can, there are many changes that occur within the body with menopause, and the brain is also affected. Um,
Hello, Dr. Ramsey, are you still there? I think we have lost Dr. Ramsey. He's still saying that he's connected. However, I'm actually not hearing him. Can you guys actually hear me at this point in time? Okay, great. Okay, so we'll just wait a bit for Okay, we'll just wait a bit for Dr. Ramsey to return to the actual show. However, we were actually just going over the different types of dementia that we have out there. So, most common cause being Alzheimer's disease. Then we have dementia with Lewy body or Lewy body type dementia, which is usually associated with Parkinson's disease. We also have vascular dementia, usually associated around stroke pathology. We spoke very briefly about possible early onset types of dementia, predominantly frontal temporal dementia, as well as dementia associated with alcoholism. Dr. Ramsey, are you back with us?
oh man, I've been here, I've been talking. I don't know what's happening. Maybe, okay, I zone out at times. What was the last you heard?
So the last thing we heard from you, I read the question with regards to menopause, and you spoke about the changes that not only occur with the body, but that can occur with the brain. And you were actually going on to break that down for us.
Okay, and then I dropped out.
Yes,
My
please.
apology again. Right.
It's
So,
okay.
okay, so I have gone on. Anyway, I'll start again. So, right. So the estrogen does have some impact on the brain, and after menopause, um, well, okay, lack of menopause can cause memory loss, and isn't something that is progressive, meaning that it does not, um, become significantly worse as time goes on, which is a feature of dementia. And then, so they, I mean, estrogen is so important that at one point in time it was thought to be the chief reason behind why women develop dementia. And again, it was around the time when the thinking was that dementia was more common in women. However, trials have been done, using hormone replacement to see if it had any significant impact on dementia, and it has not really been significant.
Okay.
Okay.
So I know the person surrounding or the man behind the disease was actually Dr. Alzheimer. And he
Yes.
actually first described it in a female patient, and she presented with a bit of what persons thought was paranoia, progressive sleep and memory disturbances, aggression, and confusion. Can you tell us why, or maybe you may not be able to answer why, because they have the direct information. We don't even probably up to this date because we're still doing lots and lots of research in the field of dementia and Alzheimer's specifically. But can you sort of try to explain the linkage between why sometimes we tend to see patients presenting with psychiatric type presentation where they may have
Mhm.
paranoia and stuff like that?
Yeah, and it's thought that many of the symptoms are the symptoms that present are quite often related to the areas of the brain that's damaged. Okay, remember this illness is it's a disease of the brain. It Certain parts of the brain becomes damaged, and depending on the area of the brain that's damaged, then you can have certain behaviors presenting. The frontal lobes, the front part of the brain, basically is the control center. It helps us to determine what is appropriate when, etc. And hence, in the frontotemporal type dementia, that is why people tend to be impulsive and like out of control. They just
Right.
do stuff before, I guess, considering the consequences or being able to consider the consequences. Um, Similarly, um, depending on the part of the brain that's affected, people can have delusions. They can
Right.
see things that are not there. They can hear conversations that are not actually happening, that are just in their head. Um, they can feel threatened and be afraid of, so whatever's in their head, and hence they can become, in their mind, they're defending themselves. You may be
Right.
approaching them, and they may adopt a defensive posture. You decide, no, it's time for you to go and get your bath. They're trying to, they're sharing their palms, leave me alone. And you grab them, and then they kick you or bite you or something, and then things escalate.
Right.
So, um, whatever, it's hard to, say, um, the brain is very complex and the areas are all interlinked, and it's difficult to say why. Let's say one person may have visual hallucinations as opposed to another one who may have auditory hallucinations, as opposed to another person who um, will have this, delusional, which is a belief that isn't real.
Hmm.
And all you can do really is try to work with those individuals. If they seem afraid, you don't approach them in a threatening manner. You approach them in a friendly kind of an approach, and you're more likely to get through to them and have them comply with what you want them to do. And if you then become, they feel threatened and then you become aggressive or you shout, you're not going to get the response that you would like to get from them. Now, normal, there are
Right.
people, there are other psychiatric illnesses. It's not really my field, but there are people who don't have dementia that also causes them to have, delusions,
Right.
hallucinations, etc.
Abs-
So
Absolutely.
it's all in the brain.
Okay. Now, you said that sometimes persons may become aggressive. They may scream out, they may attempt to bite you, kick at you, stuff like that. Resistance to care. Um, can you take us through very, very superficially, break it right down into exactly what is happening in the brain with Alzheimer's?
Well, interesting. It's hard to say,
Right,
except that there's damage. The brain is a very complicated device. Well, not a device. It's a very complicated network of neurons. These are little parts of the brain that communicate using electricity and chemicals. And any interruption can have an effect that is, hard to understand. Um, the only person that can, I guess, tell what's going on in the brain, well, what they feel is going on and what they perceive is that individual.
right,
So it's better to try to work, with them. There's no, it. Most people who become aggressive are actually, like defending themselves. They feel threatened,
right,
and to explain the intricacies of why, it could go back to childhood experiences. It could involve the relationship that caregiver had with the patient had with the caregiver. Um, it's there are many. Every case, right, is so individualized that you have to sit down and uh, right, you have to sit down and try to find out maybe what's happening. What is the you try to find out what the chief um, concern is with the patient, or what is it that is making this patient most um, feel most threatened, and try to remove
right,
it from the picture.
right. We have a few questions coming in here. I think after we weren't hearing you and a lot of yeses, I'm going to scroll back up a bit. Our first question is, can
Uh,
smoking tobacco also lead to dementia?
I'm sorry. Say again.
Can
Tobacco
sm-
and
can
dementia.
yes, can tobacco, smoking tobacco, can that also lead to dementia?
Yes, definitely. But well, directly, there isn't a direct, as far as I'm aware, there isn't a direct, hasn't, smoking hasn't been directly linked to causing dementia, but we do know that smoking um, has, can affect the blood vessels and
Right,
increase the risk for damage to the blood vessels, which can increase the risk for, of course, the stroke. All right, blockages, infarcts, strokes, etc. So, from that perspective, I would say smoking in itself is a risk factor. but it hasn't been directly um, implicated, like, let's say, hypertension, um, diabetes, um, right? So I would say I'm not aware that there's a direct link between smoking and Alzheimer's.
Okay. We had a question that was asked in two parts, but from what I gathered, there's a question where the person is asking about someone who was on chemotherapy
Mhm.
and then they essentially had a syncopal episode or they blacked out and the medication was adjusted, but after their medication was adjusted they noticed that the person became forgetful. Can that bad first experience with the chemo, could that cause all of this presentation now where the person appears as if they have signs and symptoms of dementia?
I'm not sure of the how I don't quite understand the direct pathology, pathophysiology involved, but yes, I've seen cases where people who would have started chemotherapy for various cancers, colon
Right.
cancer, prostate cancer. Prostate cancer is one of the ones that you'll see in the literature, and then have an increased risk for developing dementia. So yes, chemotherapeutic agents can in themselves increase the risk. The syncopal episode is also, I guess, um, may also be a risk factor depending on the cause for the syncope.
Mm,
Because if well, I mean, it depends on the cause, but I wouldn't say the syncope itself in this case would have been the trigger, unless the person has also been having TIAs, transient ischemic attacks, which are called stroke warnings. Many people who have transient ischemic attacks eventually go on to develop a stroke, and the stroke would actually be the result of blockage. This in this case, blockage of a blood vessel going to the brain. Now, in that since we're talking about blood vessels and the brain and diabetes, and there's the blood vessels in the brain are prone to leaking and rupture. Okay, and that too is a risk factor for brain damage and developing dementia.
okay. So we have a very good question here, and I think a lot of persons actually are stumped by this. How does Alzheimer's lead to death?
Yeah, yeah, it's if simply, I would say simply put, Alzheimer's. What happens in Alzheimer's is that the brain technically is slowly dying.
Right.
You're losing, um, first you lose your memory, but then you start to lose other functions. You start to lose control of body functions. Um, and, depending on the part of the brain that's damaged, and the body also deteriorates. The brain does control the body. And, we tend to think of the brain and how it's sensation and moving different parts of the body, but there are many other intricate, neural and chemical pathways that we don't understand. And as the brain atrophies, you know, the organs that it controls, the brain controls everything. The heart, it controls your kidneys, it controls, we don't think of this, but the brain has a connection to all of those organs. And if the stimulus isn't coming from the brain, those organs eventually will start to fail as well. But what happens in most cases, a person who dies with Alzheimer's disease, they are quite often very frail. They become bed bound. They need to be fed. They need to be turned. They need to be cleaned. Everything has to be done for them. And that also increases the risk for getting things like pneumonia, which is often called contributing, the final event in death.
Right.
Um, they can get infections in the bladder, skin infections. They can get wounds on the skin, pressure ulcers, which can become infected. And any one of these factors can then be the final event. The infection becomes the final event. But what is the major factor here is the fact that the Alzheimer's has been causing the brain to deteriorate and the body to deteriorate over time.
Right.
So yes, in some cases, Alzheimer's you will rarely see Alzheimer's listed as a cause of death on a death certificate here in Barbados, but quite often it is the chief contributor to that person dying.
Right. So essentially, there's a progressive loss of function as the disease process continues to prevail within the person. So you may start off, you know, having the inability to cook for yourself or travel alone. And then there comes the point where you're unable to even dress yourself or groom yourself. And it may get as severe as the inability to walk or even want to eat. Quite often, we may find that persons have difficulty or have no desire to eat um, as the disease process progresses. Um, we had a caller calling in. I'm just going to take this question here on the message board before I get that caller to call back in. What is the current theory of what causes Alzheimer's disease?
Interesting. Uh, all I can tell you is that what we understand is what we see when we look at the brain, the pathology, and the brain cells have a particular pattern,
Right,
and that kind of helps with the diagnose. With the diagnosis, let's say confirming the diagnosis.
right,
Why those changes occur is still not well understood. Um, However, there's quite a bit of research going on targeting, the buildup of those plaques
right.
in the
So,
brain,
right,
right, and there are drugs that have been targeting these sites, which have been, clearing the plaque, etc. But we really still don't fully understand the disease. And what has come out is that, even with, and we're speaking more about Alzheimer's here,
right,
and what has come out is that even within Alzheimer's itself, there are several subtypes. So it's much more complicated than so complicated that we don't quite understand exactly, why these things happen.
right. Because I remember initially, well, when I first started doing my research about Alzheimer's and reading up about it, we often thought that depending upon the extent of beta amyloid plaques that persons had would determine how significant the disease process was.
That's
And then
right.
that completely changed to the amount of tau tangles that we had. So there's still lots of research going on in this space, and we're still learning new things every single day about this disease. And the only true way to absolutely confirm that a person has Alzheimer's disease is in death at postmortem, right? So I wanted to switch gears a bit in our last 10 minutes, however, and because I know a lot of persons, especially in the Caribbean, tend to think if they see an elderly person behaving differently, getting aggressive, doing things out of the ordinary, they're very quick to say, oh, that person is wicked,
Mhm.
right? And they're
Yes, yes.
stressing them out. And it might not be that they're trying to be wicked or they're trying to stress out the caregivers. So I wanted for us to touch a bit on specifically how caregivers can have a situation where they understand the pathology a little better, which I think we've done quite a good segment before this piece, essentially highlighting what caregivers and allowing them to understand the disease process. But I actually want to spend a little time now specifically for the caregivers. But before we jump into that, I have a call on the line. Good evening. You're live on the call.
Yes,
Yes, good evening.
my call relates to caregivers, as you will know, um, moving into the common thing in our Barbadian society is that when this disease is progressive, but we do not want to put mommy or daddy in a home. At what point in time do we make decisions about when we have to move to a different level of care where the individual is able to get 24-hour care? How should families start to process those? What should things should drive that kind of decision?
Thank you.
Well, okay, right. As it relates to placing someone in a nursing home or a care facility, it's a difficult decision to make. Um, but first, the caregivers need to understand what they're dealing with. They need to understand, well, they need to accept one that this person has, let's say, Alzheimer's or any other form of dementia. They would then need to understand that they need to put certain things in place to make sure that that person is safe and that they're well cared for, and their nutrition is looked after, hygiene, and as I said, that they're kept safe. Now, if those things can all be done in the home setting where the patient lives, I mean, there are a number of studies which would suggest that that is the best setting for the individual. That's for the
Mhm.
individual, for the patient,
Right.
because it's familiar setting. Um, everything is familiar. The sounds, the smells, the everything looks familiar, and those are some of the things that can help to keep the patient who's suffering with the illness, calm and also help to so that they can have, let's say, the best quality of life possible. Now, if the caregivers have reached a point now where they cannot do that, whether it is that the care that what the person what the person needs is now beyond their means, their ability to do it, or their ability to hire someone to do it in the home, well, then that's when you really need to look at professional care, moving the person into a long-term care facility where the needs can be met. So
Mm.
it's right. So
Hello.
it's a process. Yes, I'm
Right.
back.
Good. I
Yeah.
can hear you. Right.
Right.
Good.
Yes. So it's a process that, and you know, it's important that this process involves all the persons involved in the care, or as many as possible, all the siblings, the spouse, siblings, everyone involved in making the decision.
Right.
Otherwise, you can wind up have situations where there's a lot of contention and either you wind up with the patient now suffering because optimal care is not being provided, or a caregiver or a number of caregivers then have so much of a burden that they themselves are now also at risk where their health is concerned.
And I'm glad that you actually highlighted that point because caring for someone with dementia has been shown to be associated with higher levels of stress than caring for persons with any other type of chronic illness. And often caregivers tend to neglect their own health as in an attempt to try to provide the best care and the safest care for their loved ones. Um, I do like the fact that you highlighted the importance of allowing that person to stay within their environment, provided that that is financially feasible, and allow it to be a cumulative discussion, a group discussion where everyone can participate in terms of, including sometimes if the person is not, the cognitive deficit is not too severe,
Yes.
including the patient to make that decision. But what are some tips very quickly that you can give caregivers? Because sometimes with that neglect of caring for oneself, caregivers can sometimes get very upset, very worked up, and it can lead to persons who have dementia experiencing abuse. Sometimes that's something that we
Yes.
don't often like to speak about, but is a reality, elderly abuse. So can you give us a few tips for caregivers so that that is not the end point, because that's not really what we want.
All right. So the first would be to know the individual. I mean,
Right,
in most cases, the caregiver will know the individual quite well, know the illness. So read as much as you can about dementia, as well as the strategies to help cope. If there's a support group in Barbados, there's a support group. Um, get in contact with a support group. They will help you to deal with the challenges of caring for someone with dementia. Again, yourself. Now, look after yourselves. You need to make sure you get rest. Put things in place so that you can rest. If you have medical illnesses, you need not to neglect them, because if you do become ill, then who's going to look after your loved one if you become ill? And so I would say those are the main factors. So rest, know the illness, know your individual, know the illness. Um, Make sure that you pay attention to your own health, and make sure you get rest. Okay. And of course, support groups are out there to help you to navigate, um, you know, the illness.
great. Um, Very quickly, I have known of someone who recently actually had a very scary experience where their family member would have walked away. Well, they would have lost their family member in terms of the person walking away from the care of of their loved one. Are there any monitoring modalities out there for persons to be able to track their loved ones locally on the island? Do we have any such capabilities here on the island? Hello.
Yes, there are. I do not.
Okay,
Yes, yes, you can hear me. Yes, there are a number of
I can hear you now.
companies now, and y- yes, right, there are a number of companies. Many of these security firms can offer the service. Technology has improved. Even tracking
Yeah.
devices. You can use cell phones. You can use watches that are smart watches. You can
Right.
set up what are called geofences, etc., which can alert you when the person goes beyond a certain perimeter, which you can set up, just on a map. And you can do it yourself. You
Right.
can hire security companies to assist you with doing that. But the important thing is that the person needs to be wearing the tracking device. Okay, so that's one.
Great.
That's one strategy. Of course, you can make sure that the person has ID on them to identify them with contact information, how to maybe a card or a bracelet with the contact information with their address and a contact number. Okay. There are other things that really need to be put in place in Barbados, but that can help. But of course, you'll probably have to look to um, I don't know. I will just say it can be done.
Right.
Okay,
Okay.
but it would just need planning and coordination, etc.
Coordination.
And okay, yes.
Great. So we are at the end of our show. I mean, this hour went too quickly. I still have some more questions. Maybe at a later date, Dr. Ramsey, you can come back out and continue our conversation on dementia, because there's so much to learn about this area, not just for the sake of the patients, but also for the sake of the caregivers. So, Dr. Ramsey, I just want to say thank you so much for
Yeah, thank you
coming
for
this
having
evening
me.
onto our show. And again, also thanks to our listeners who have participated in both the call-in section and the message board. Once again, I encourage you to follow us on both Podbean and Anchor, and join us next week on First Aid Chats by Dr. G, Closing the Gap. Good evening, everyone, and thank you so much, Dr. Ramsey.
Okay, good evening.